Hi, everyone. My name is Emily Whalen, and I will be presenting the Clinical Practice Guidelines training this year. My role here is the lead autism care manager on the Children's Community-Based Support Team. I like to switch up this training each year with new content, so it's my hope this will serve as both a refresher and an opportunity to learn something new about our clinical practice guidelines. I am hopeful we will cover some areas where you may need a refresher and learn something new about our clinical practice guidelines. These are the objectives for this training. So first, we will introduce the clinical practice guidelines. Then we'll dive in deeper and understand them a little more. We'll try applying them. And then we will learn where we can locate these useful resources. So let's start with introducing the clinical practice guidelines. So for those that are new to Magellan or need a little refresher, we're going to review what the clinical practice guidelines are. So let's ask ourselves, what are the CPGs? These are evidence-based guidelines used to help determine the clinical appropriateness of services. They should target acute, chronic behavioral health conditions, and they can be used by us at Magellan, our providers, and members and families to help guide their treatment. Magellan develops or adopts clinical practice guidelines to assist providers in screening, assessing, and treating common disorders. Prior to adopting each guideline, a multidisciplinary panel, including board-certified psychiatrists and clinical staff, will examine relevant scientific literature and seek input from in-network providers, as well as our consumers and community agencies. Once implemented, Magellan reviews each guideline at least every 2 years for continued applicability and updates guidelines as necessary. The clinical practice guidelines are a universal system, so they're not just relevant to behavioral health. As you heard me reference in my autism training, the clinical practice guidelines were just updated by the American Academy of Pediatrics in December of 2019. This is one example of how a clinical practice guideline outside of the behavioral health field can be adapted into our own Magellan Autism Clinical Practice Guideline. When we think of the words clinical practice guidelines, we want to associate it with evidence-based practices. These are meant to help guide providers and members to making healthcare decisions. These evidence-based practices are systematically developed and based on data-driven research and findings. Think about when you were back in school and your teacher wanted an accredited research journal article to support your findings and wanted your reports to include current and up-to-date research. Keep that same clinical hat on while you're thinking about clinical practice data and research, because that is what is used to form these guidelines. These clinical practice guidelines do have limitations. Although we are using the most current research developed for evidence-based practices, there are other factors that still come into play when choosing a treatment path. As a whole, we still need to consider individualized treatment needs. We also need to see if the treatment approach selected meets criteria through our medical necessity guidelines. This will also vary based on a member's eligibility, their benefits, and the medical necessity criteria for the level of care needed. So again, the clinical practice guidelines serve as a reference guide, but not a final determination for appropriate treatment steps. These are all listed on our provider website. As for the previously adopted guidelines, these clinical practice guidelines were previously adopted by Magellan. They remain available to our providers as portions of the content remain relevant to the current clinical practice. These were recently changed, so please go and check them out and refresh yourself. They are not the same as what I presented on in 2022. When we get to the understanding section of the clinical practice guidelines, which is actually next, each section is designed to be a little different in regards to what information you can pull from these guides. Some will cover stats, other will cover interventions, and some can be quick reference guides and tip sheets that you can actually pull and utilize for easy access, which is a great resource. So each clinical practice guideline is developed differently. So next, we'll go into understanding these clinical practice guidelines. We're going to see how it impacts our work and the work of our providers. So through the TRR review process, Magellan explored if providers had implemented national CPGs for use with the member population. Results are expected to be 85% or greater. Those not meeting this goal were addressed via an action plan. This goal was met. In 2022, 55 clinical practice guideline audit tools were completed as part of the TRR process. From applicable TRR opportunities, there were 981 members' records reviewed against applicable clinical practice guidelines. Those 981 member records supported 55 provider clinical practice guideline reviews. So the 85% benchmark was met across 4 out of the 5 audit tools with a range of 67% to 98%. The previous year ranged from 83% to 93%. So you can see that there is a little bit more variability in this range. I did want to make note that no charts were reviewed for suicidal ideation risk in 2021, which would cause a false correlation for a true increase in the suicidal ideation risk score, but it still had increased from 2020 scores. SI CPGs are only completed when there is active SI encountered in a member's chart. The main objective of the clinical practice guideline monitoring includes assessing performance against important aspects of the clinical practice guideline, measuring the current diagnostic and treatment practices of network practitioners with respect to the evidence-based diagnostic and recommended intervention criteria, identifying areas of strength and weakness in practitioner compliance with the clinical practice guidelines, and designing appropriate training interventions that will increase compliance with the clinical practice guidelines. So let's look at the ADHD clinical practice guideline audit. There was about a 10% increase from 2021 to 2022 data. All of the categories scored 100% except for coordinated care with medical provider and medical evaluation during diagnostic process. This is something we can stress to the providers as they are probably coordinating, but they may not be documenting this enough to show in their records. IBHS providers are currently seeing the similar trend with our IBHS TRR clinical measurement tool process. As care managers, we can actively shape this during our telephonic calls and packet reviews with our providers. We can also see where this is being documented and making sure that whatever is being submitted to us is showing their coordination of care efforts. If you're looking for a few examples of the clinical practice guideline citations and references of coordination of care, these are direct examples pulled from our clinical practice guideline, which providers and Magellan staff can reference as a way to help incorporate coordination of care within their documentation. So I'll read an example. The high prevalence of ADHD and limited mental health resources require primary care pediatricians and other PCCs to play a significant role in the care of patients with ADHD and assist them to receive appropriate diagnosis and treatment. Treatments available have good evidence of efficacy, and a lack of treatment has the risk of impaired outcomes. To continue providing the best care, it is important for a treating pediatrician or other PCC to engage in bidirectional communication with teachers and other social personnel, as well as mental health clinicians involved in the child or adolescent's care. This communication can be difficult to achieve and is discussed in both the POCA and the section on systemic barriers to the care of children and adolescents with ADHD in the supplemental information, as is the medical home model. The PCC may benefit from additional consultative support and guidance from a mental health subspecialist, or may need to refer a child with ADHD and comorbid conditions such as severe mood or anxiety disorders to subspecialists for assessment and management. Next, we'll look at the major depressive disorder, CPG. There was overall variability within score changes from 2021 to 2022. There was stability or an increase in 3 criteria, but an overall decrease in all other areas. The biggest score drops were in assessing for dangerousness to others and treatment plan, including the use of either antipsychotic medication or ECT, or clear documentation as to why not. Here again are 2 examples pulled from the CPG to support the audit criteria. In our clinical advisor's view, ECT is appropriate for using in these special cases: severe psychotic depression with severe suicidality, catatonia, or not eating, so that remission can occur as soon as possible. I apologize, the second example was on the next slide, but we will read it. For depression that is recurrent, unresponsive to treatment, or psychotic, the NICE guideline recommends intensive psychological therapy of an alternative therapy than what was already tried, either individual CBT, interpersonal psychotherapy, or short-term family therapy, lasting at least 30 months, or systemic family therapy, or 30 weekly sessions of individual child psychotherapy. This treatment may be done with or without fluoxetine. If the child is unresponsive to fluoxetine, then sertraline or citalopram may be used. The NICE guideline recommends against using Paxetine, Phenylaxfen, tricyclic, antidepressants, or St. John's wort. For psychotic depression, the guideline recommends that consideration be given to augmenting treatment with an antipsychotic. The guideline goes on to discuss inpatient care, ECT therapy, discharge planning, recurrent depression, and prevention of relapse, and the transition of the child to adult services. Areas not covered for children and adolescents in the APA guideline. The NICE guideline also contains recommendations for future research based on the panel's review of the research evidence. The schizophrenia CPG showed a large increase from 87.39% in 2021 to 95.45% in 2022. The 2 criteria that showed the most improvement was if the provider finds there is evidence of potential patient noncompliance with treatment, provider plans interventions to address noncompliance, depot meds, outpatient commitment, medication groups, family support, self-help groups, with an 83% jump. And if initiating treatment with a second-generation antipsychotic, the provider documented baseline physical and lab results and documented periodic monitoring of these parameters. So weight, height, lipid profile, and fasting blood glucose with a 5% jump. So these are examples of the adopted guidelines in the areas that are covered for schizophrenia. For managing suicidal patients, 3 of 981 charts were reviewed this year, but remember, there were none reviewed last year, so I'll use comparative data from 2020. This is only reviewed when there is active suicidal ideation in a member's chart. Listed above are the guidelines that were adopted and or created by Magellan for the CPG of managing suicidal patients. Based on areas of improvement noted in the last slide, these are specific examples I pulled out of the CPG that can be used by Magellan or the providers to increase education and documentation of these assessment and treatment efforts. Arrange for the removal of the patient's access to weapons, especially guns. Assess, identify, and work with a family member, friend, or authorities in assuring that the weapon is removed. Has a suicidal ideation been shared with anyone else besides the therapist? Who is or could be helpful in managing the ideation? This calls for the involvement of family and or significant others. Family and or significant others can assist in obtaining data about the patient and provide containment and feedback during treatment. Sometimes suicidal communications may be made to family and or significant others rather than to a healthcare professional. Optimally, as part of the safety plan, such collaboration should be with the patient's permission. It appears to be a significant factor to include family members and key support system people in the overall treatment team. Specifically, the family and significant others can be instrumental in limiting access to lethal medication and other means, as well as providing ongoing support to the individual. Last but not least, the substance use disorder CPG is where we saw the biggest drop in scores. We went from 66.62% in 2022 when compared to 88.58% in 2021. There were no areas of stable scores or improvements. All scores showed a decrease, with the biggest decline in referral for a psychiatric evaluation if a provider is a non-MD and there's no recent evals, and if the provider is a physician, evidence of considering abstinence aiding MAT medication, and evidence of attempting to collaborate with any physician prescribing meds. We have both adopted guidelines and Magellan created top tip sheets for quick access to screening, screen administration, treatment, and references and resources. So even though there was not an audit completed for this CPG, I want you to see that they exist and they have updated articles for each. So next, we'll look at applying these clinical practice guidelines. So as care managers, how can we use these clinical practice guidelines? We can kind of think about this in 4 different ways. For our own personal growth, for provider shaping and documentation, when we do a whole person conceptualization, and for family and member resources. So when we apply these clinical practice guidelines across populations and scenarios, these are certain things that we can utilize or change the way we think about them. So for case conceptualizations, we need to consider everything. So we need to consider physical, emotional, behavioral, cognitive needs, and any other system involvement. We can use them to decide what is and is not clinically appropriate. We can look to them for ruling out comorbidities and help support when making referrals and making sure this is also documented. We can use it to help understand research, statistics, new studies that are considered supported versus those studies done to support claims and treatment plan development. I'm so sorry. Understanding research needs statistics and new studies that are considered as being supported versus other interventions that may be categorized as needing more studies in order to support claims and treatment plan development. We can look at epidemiology, etiology, screening, assessment, evaluation, treatment planning for disorders you may or may not be familiar with. We can help debunk what is considered a myth and or trend versus what is considered as being an evidence-based practice and or APA recommendation. To piggyback off that, we can use it to determine what interventions are appropriate, whether it be psychosocial or pharmacotherapy interventions. We can use the tip sheets and the CPGs as quick guides for our loop calls or our call center calls when they come in through our phone lines. And most importantly, we can reference our clinical practice guidelines during our provider shaping calls, our rounds presentations, and any other support calls with members or families we may receive. So next, we are going to learn how we can locate the clinical practice guidelines. So first, there's actually two different ways for us to locate the clinical practice guidelines, and I'll go through each of them. So there's the first way, which is for anybody to access. So that could be members, families, people in the community, schools, anybody that's not a direct provider. And of course, then the second way would be for our providers to directly access. So I also wanted to put in a plug here for our online newsletter. It's called Provider Focus. The Provider Focus will actually update and share guideline changes. And if you want to see information related to Pennsylvania Health Choices, which is us, you can find specific updates for our plan. However, if you work with commercial Magellan or some of our other plans, you can search by region and or plan specific updates as well. So it's a good tool to have, especially if you're working with other sectors of our division. So first, we will go through how to get access to clinical practice guidelines for anyone. So we'll go up to home on our Magellan of PA webpage, click that. We will then click provider resources, this tab right here. Then we will click clinical practice guidelines right in this drop down, and it'll bring you to this page that explains the clinical practice guidelines and then has a link to get us to the physical location of these guidelines. Once you click that, it's just going to populate you to our provider webpage, and you can locate the clinical practice guidelines right here if you click this. So again, once you're on this page, you can have quick access links that have all of our clinical practice guidelines over here, our previously adopted guidelines. And then if you keep scrolling, each guideline will have its own carve out and link. And again, if you want to get into our newsletter, Provider Focus, you can access that right here on this page. I do find it helpful to always do a live walkthrough of how to access the clinical practice guidelines. So you can see that here I am on the Magellan main page. We can go to the providers page. And we can go scroll down here to provider resources. We can click the link for clinical practice guidelines right here. Here is the information page on the clinical practice guidelines, and we will scroll down to Magellan's clinical practice guidelines. And this will launch you to our providers page, and you'll come right here to clinical practice guidelines. And here you can see our quick links, our previously adopted guidelines, and then our section breakdown of all our guidelines and adopted guidelines so you can utilize them. Also, I know we discussed our audit tool today. You can actually access that right here. I will show you the second way to just go for our providers to get quick access. You'll just log in to your MagellanProvider.com website, go to Providing Care, Clinical Practice Guidelines, and right here, you'll click Clinical Practice Guidelines. And again, it'll take you to that main page where you can get the full breakdown of all of our guidelines. That is all we have today for our clinical practice guideline training. Thank you so much and enjoy the rest of your day.